So one of the most important risk factors for MS is actually being a woman.
Dr. Nicholas Lannon is a neurologist with Spectrum Health. He tells us that MS occurs when your immune system does not act how it should, and that causes injury to your brain, spinal cord, and sometimes the nerves of the eyes.
It's a complex interaction between your genetics, a little bit of chance, then a little bit of these environmental exposures. Other environmental exposures to be aware about can be infections in youth, can be things like if you're a smoker, exposed to smoke. So it's a big complex interplay, and there's not always a single answer like in other diseases where we know that there's one gene associated with it.
It tends to target women in their 20s to 50s, but can happen during any decade of our lives.
Being from Michigan, one of our risk factors is low sun exposure, we think. So having low UV light and possibly low vitamin D levels.
One of the most important parts of our immune system is the white blood cell. It helps destroy bacteria. In MS, those same cells then target the brain.
What can happen is they become misdirected and start to treat the brain like it's an invader. Our brain cells are a big network of interlacing cells that are almost like electrical wires. And they're covered in a fatty substance called myelin. It's sort of like the coating of a wire.
In MS patients, that coating is damaged, causing injury and inflammation.
It's a quality of life question and a functionality question. The symptoms to look out for are very varied because depending on where the injury occurs in the nervous system, you can have very variable symptoms. One of the common ones is called optic neuritis, where the nerve to the eye becomes inflamed.
That translates to eye pain and vision loss. You could also experience clumsiness, sensory changes, weakness, and issues with bowel or bladder control. That's why an early diagnosis is key.
We have many treatments now on the market that can help lessen the effects of MS and help you live a more normal life.
That was our Ryan Cummings reporting. There are many conditions that can mimic MS, so if you have any symptoms, talk to your doctor to figure out your next step.